evening, everyone. It's my pleasure to welcome you to our very first live webinar series on dementia and Alzheimer's, a joint initiative by Better Daily Life and SarvAveksha. My name is Anupi John, and I'm the managing partner of Better Daily Life. Thank you very much for your interest in this subject and joining us today. We will be sending you all the updates about our next webinars and request you to share it with your friends, family, and colleagues. Let's start this session with a small video. Request everyone to watch this.
Are you all right?
Yeah.
How far along are you?
What?
Well, I was just wondering how long... Sorry.
I'll be 21 weeks on Tuesday.
Not long to go.
That's easy for you to say.
You're finding it tough. You must be excited.
I'm scared.
Of what?
Everything.
I'm sure you'll be fine.
People say that, but what if I'm not?
You'll manage. Everybody does.
Do they?
What about your family?
It's complicated.
You don't get on?
It's just me and my dad. And he's sick. So,
It'll be okay.
come on, this is us. Dad. Come on.
Anyone? I mean, we have little time, so we have to fasten up our... Can someone share?
Hi, this is Dr. Sarita. Can you hear me?
Yes, we can hear
So
you.
I think at the end it says, "Come on, Dad, let's go." So looks like there is a conversation, and the gentleman doesn't remember that it's his daughter, and he's talking to a person as if it's a third, like the person he doesn't know. But at the end she says, "Come on, Dad, let's go." So it looks like he is the dad. So they are in a situation where he's not able to recognize the daughter, and daughter is really upset, and she's almost due for delivery. She's finding it hard to go.
Thank you so much, Sarita. That's exactly what happened in that video, right? So it looks like the man who's sitting there, the gentleman, is not aware that the other girl, the lady, is his daughter. So I would like to start the question to Dr. Praneeth from this. So what is dementia? Like, what are the early signs? What are the early signs that a person can see?
Yes, Swati. Yes, this is dementia because father was not able to recognize that she is his own daughter. So that's why it is a dementia. So dementia is a progressive declining in a cognitive function, which is like power of reasoning, thinking capacity, at the same time a logical way of thinking, and a language, understandability about the language, the words. That's what a declining in a cognitive function. So that's a dementia. Usually dementia is seen in elderly people with more age of more above 65 years, but not 100% like all the elderly person or aging person we will see this. But it is noticed that this dementia is more noticed in women compared to men. Okay, and certain rare conditions of dementia are also seen in youngsters, but it is very rare. So when it comes to dementia early signs, it depends on what's the cause of dementia. Based on cause of dementia, we see signs. So basically like forgetfulness, they keep forgetting things. They keep something somewhere and they forget where it is, and at the same time, they go to a places of familiar places and they feel like, oh, and they wonder like where they are. Okay, and at the same time, like they lose the track of time, like what day is a date, what time it is today, and certain times they feel like in the afternoon they have to have tea, so certain declining. These are the early signs we do see in dementia.
Okay. So you're saying that forgetfulness is kind of the basic thing that is like a sign. It starts from there, that we can understand that one of a person, it could be dementia, right? Okay, so now coming to what can be the reasons, Dr. Ashwajit, for someone to get dementia. Is it hereditary? Like, is it in genes? They say, like if your father has, you will also, there's high chances for you to have. And like, I don't know, stress. What can be the reasons?
Yeah, that's right. So there are various reasons for someone to have dementia. Yeah, and it's usually, they say, an injury to the brain, which can be a physical injury. It can be even a vascular injury or infections, which can cause dementia. Yeah. So it can be because there is less blood supply to the brain, like a vascular reason, what it is called in the medical term. But somewhere there is, it can be because of hypertension, because of diabetes, which causes inflammation in the blood vessels and reduces the blood flow to the brain. Yeah. Then there can be some causes like what we say, some protein which gets deposited in the brain, replaces the normal brain tissue, what is called the Lewy body. Yeah. And since the normal tissue is replaced, and mostly it affects certain parts of the brain which is related to memory, and that's how dementia occurs. Then there can be reasons like somebody having a stroke, that can also cause dementia. Then there are other reasons like infections, I said, or physical injury, repeated head injuries, repeated physical injury to the brain, yeah, can also lead to dementia. Then there can be infections like we see in HIV, where because of infection, the normal tissue of the brain gets atrophied, yeah, which is, the normal brain shrinks in size, and that can cause dementia. Then there is the most common cause of dementia is Alzheimer's. So 60 to 70% of dementia is because of Alzheimer's. And yeah, these are some of the causes which causes dementia.
Right. So you did mention about the word Alzheimer, right? I've always got confused between what is dementia and what is Alzheimer. Like, though both kind of sounds the same. Like, it's very relatable to me because my father had it. So I think there was a huge confusion in the starting to even like recognize, is it a dementia or Alzheimer? So I've always understood that dementia leads to Alzheimer. But now you say like it's like a cause. So like, can you like explain the difference between that?
Yeah, so dementia is a symptom where there's loss of memory power, there is loss of function. A person loses ability to perform his daily activities, difficulty in recognizing, difficulty in, even analysis, like calculations. Mostly it is calculations. So all this is dementia. Alzheimer's is a cause. In Alzheimer's disease, you find that the person presents with dementia. So Alzheimer's is where there is deposition, like I spoke about Lewy body. Lewy body is one. In Alzheimer's, you have beta amyloid, a type of protein, or a tau protein, which gets collected between the neurons. So because the neuron gets, this protein gets accumulated, the transmission of impulses, or we can say the messages in the brain, gets hampered. So there's no transmission of impulses, which causes dementia. So that is what happens in Alzheimer's. And so dementia is a presenting symptom in Alzheimer's.
Right. Okay. Now that's clear. It's more like you get a fever and then you analyze, is it COVID or what? So it's like that. So Alzheimer is like that, and dementia is a symptom. Like, it's like what you see outside. Okay. So now I also understood that you happen to mention at the starting, it will be there. At the starting, forgetfulness. So what happens after start? Once it starts, what happens? Is there like stages of it? And how is the progression and all that?
So yes, so already I've mentioned about early signs, like in dementia. So there are different stages. We need to understand, like when it starts as a mild, like slowly, like a simple thing, forgetting a thing. So which we have explained you already before. Where next it comes to the middle stage, where a person forget the names of their relatives. Okay, and they keep repeatedly asking the same questions again and again. Okay, and they also lost a track of time, where like they don't realize uh, what time of a day. Okay, and communication skills are also hampered. Certain time they can't communicate, they forget the word, they can't communicate with a person. So these are, like, you will see in between, like you can see drastic changes from early and the middle. Like, okay, something like went wrong, like early stage of people, usually they feel like, okay, it's an old age, that's why they're forgetting. But later on we see that that forgetfulness has been increased in a way, like the communication is also hampered. Like, okay, the person is not able to communicate, the person, like, he goes to the place where, like, in their home, in their own house itself, they forget, oh, where I am, what is this place, why did I come here. Certain changes you can notice. Then what happens, they enter into the late stage, end stage, where it's like they completely become inactive, they completely forget things. Okay, and they sleep at their own time, they wake up at their own time, they walk in the night times, and at times they forget that they have to swallow, they have to drink, they have to eat. Okay, and the facial expressions are completely gone, like they forget their own family members. So you can see that drastic changes from first, second, and third. In the third is like completely, the person just sits like that, and he wonders, like, we feel like, why he's not giving any facial expression. At times they become aggressive, violent. At times they'll have no expressions at all. So it ends with, like, they keep forgetting that they have to chew, they have to swallow. When you keep some food inside mouth, they feel like, okay, what to do now, what is this. So that's different stages of dementia.
I want to ask a quick question here. So you said you clearly explained the stages. So how long does it take for a person to go from one stage to other, say like from early to this to that? Like what is, like, is there a time span?
So it depends on what condition it is, what cause of dementia. Okay, and also usually it takes a period of 5 to 8 years, where you see all the three stages, they decline. It's not like in within a year or month. Suppose if something happens aggressively in a month, then we have to find a cause. What is the cause of it? But usually a dementia, it takes years together to decline from first stages to the second and third. And it depends on what condition it is.
Doctor, who are the people likely to get dementia?
Yeah. So like you would have noticed, and we take care of mostly elderly people. So it's the elderly who are more prone for dementia. People above the age of 65 is what normally is seen, but doesn't mean that every old person or every elderly person has to have dementia. No. And also it doesn't mean that it doesn't occur in younger population. It does happen where we call younger population having Alzheimer's, which is very rare, but it does happen. Between the age of 40 and 50 it is seen. So these are young Alzheimer's or young dementia patients, but mostly it is like seen in people who are above 65. And like Dr. Praneeth mentioned, most of them are women who are found to have dementia. And also the caregivers are mostly the women. So, the caregiver burden is also among the women, which is more. So it's like really a difficult case.
Is there any treatment for this particular condition?
Yeah. So before we come to the straightforward answer to your question, there is no definite treatment to cure dementia. Okay, there are certain treatments which we give to slow down the process and increase the quality of life and make sure that they are healthy. Okay, this is what the main treatment when we deal a dementia person. But before we jump into the treatment, usually it depends, we have to diagnose why dementia, because it's very important. At times in our own family members, they forget things. We can't say that, okay, they are having dementia because of some reason, and we can't expect that they will have a progressive decline in cognitive function. At times, even depression also causes this. Okay, at times, people not maintain their healthy nature, as Dr. Ashray said, that uncontrolled hypertension, uncontrolled diabetes, okay, a lack of physical activities. All this hampers the health, blood vessels, and which also reduces the blood circulation to the brain. Yes, and dementia occurs. So it's important to find out what is that. Nutritional deficiency, is it? What is it? So we go with the basic investigations, we get an yeah. So general investigations we start, and also we do a basic investigation of like CT brain to see is there any brain defect, is there any abnormal defects in the brain. So these are the basic investigations what we do. Okay, coming to the next, we try to treat if there is any abnormal reports, like it could be thyroid issue, it could be a vitamin B12 deficiency, or it could be hypertension, diabetes. So you have to treat. We have to treat that. Then coming to the point of
Sorry, Mr. Lawrence, can you please mute yourself?
Yes.
Thank you.
Thank you, Lauren. So yeah, so that's what first stage of investigations we need to do, and then we confirm what type of dementia, what is the cause of dementia. Based on that, the treatment goes on. So in general, dementia, treating a dementia or Alzheimer's, whichever the common causes, it is an integrated approach. It's not just treating with medicines. It requires a longer support of including social support or psychologist support, including this safety of an environment where they stay. Okay, so it has a multiple integrated approach. At times we also suggest physical activity with the physiotherapy, nutritionist, to make sure that nutrition is given to the patient, and always to include family members and caregivers also in the part of a treatment, their quality of life, how it is maintained, and supporting, including the legal aspects. Okay, coming to this, making sure that safety, because they forget things, and they also at times, they have accidental falls. So make sure that the furniture at home is arranged in proper way so that they don't fall, and make sure that there is a person all the time next to the patient, where when they walk, make sure that they accompany them, and they always supervise on the person's activity, what the patient is doing, is there any decline, are there any confusion. Certain times they become angry, so try to deviate their topic, and accompany, talk to them. It's very important. And other aspects, legal aspects, it's important who takes the responsibility, who is the attorney, including the health decision of a patient. At the same time, is there any other, discussing all these aspects much early, the moment the person got diagnosed, is a very important step. Okay.
So the legal part is more about maybe the banking of the person. Person might be having a bank account but is unable to sign. So what are the legal steps to be taken? You need to meet your advocate. The family needs to find out on that. Then it's about the property issues. Yeah, all these things need to be sorted out when you have the initial stage of dementia. Even, the doctor says that the person could be having dementia. Yeah. So we do have a scale, what we call a cognitive scale, which we use to assess if the person is having dementia. Yeah. And that scale tells us whether it is a mild dementia or a moderate or a severe kind of dementia. So if it's a mild dementia, then you take accordingly your steps, about all this. So it is actually an integrated, and it's a management, not a treatment. But yes, we do have medicines which are supposed to delay the progress, but there is not much of evidence and how much can it delay the progress of a dementia. There are medications many would have heard, or you would have heard, like Donep, Admenta. So all these are given in the initial stage of dementia. And if you find that it's really not helping, it becomes a pill burden for the person to be taking so many medications. Medications are also required because there are a lot of behavior changes in people with dementia. You find them to be more anxious, like Swati mentioned at the beginning, that the patient gets very anxious. Yeah. So you found in the video, that the patient was very calm. But there are stages where the patient, in the initial stage, when they start forgetting things, they know that they are forgetting things. And that gives them a lot of anxiety, gives them a lot of stress. So you do need anti-anxiety pills for them. Yeah. But you also, at the later stage, they can become very aggressive. They can be violent. So in those stages, you need to give them some medications to calm them down. Yeah. And this also becomes very challenging because the family says that the patient is sleeping most of the time or is drowsy. And we don't want him to be like that. But it's important because it gives rest to the patient. The patient, when he becomes aggressive or he's walking around the house all the time, can exert the patient physically and mentally. So these are some of the medications, but also the newer one, we say, in the trial process, it is where immune modulators can be given for Alzheimer's, mainly because it removes the plaques from the brain, is what is said. But again, there is no definite evidence towards it. And immune modulators can also, we have to see whether the benefits outweighs the risk of other problems with immune modulators. Because when you are giving immune modulators, you are actually playing with the chromosomes, the genes of the person. And it can happen that you try to correct one gene and in the process, it can harm another gene and the person can end up with having some other problem. It could be even a person developing cancer. So it has to be looked into it very carefully, and patients or the relatives should not insist on medications. The doctor knows the best. Meet your doctor. Always consult your family doctor or the specialist.
But it is also seen that, our families have been burdened out a lot with the cost, because providing the care for dementia with the integrated approach and providing the care at home, it's a challenging for the family. No, initially, yes, as Dr. Asher said that people like initial stages of dementia, they understand that they are forgetting things. It causes a lot of anxiety, a lot of depression, and they fall into a sickness like, oh my God, how I'm going to live like with the dementia. But once they reach to the second and third stage, the thought process, they immediately forget they forget dementia, immediate information, like just now, recent information. So at those times, the anxiety for them will be lesser. Okay, we need to understand that. And providing care with such situations, it depends on a cost. Like, family has to spend a lot of money and, it's burden out the family. And, certain times it's very important the caregivers or the family members need to take rest, So in the process of understanding this,
Yeah,
like,
because also there are some respite care homes, where a patient can be probably shifted for a shorter duration of time, which gives respite for the caregiver, the family, so that they can get some break. And we find that this usually happens. But also what happens is the family undergoes a kind of a guilt that I'm leaving my family member, my parent, into a home. But they need to understand that everybody needs a break. Everybody needs a time for themselves, because this is not a disease which affects only for, say, 3 months, 6 months, 1 year, and the person will get better. No, it's going to progress. It's going to get more and more difficult and more challenging. So it's important that everybody needs to, the caregivers, the families need to take care of themselves while they are taking care of the patient. So this is the most challenging. And like what Dr. Praneeth said, the late stage where the patient, forgets to eat and swallow, again becomes a very emotional challenge for the family. The family says, my parent cannot swallow, so they are hungry, they are thirsty. So what do we do? Shall we put a tube and feed them? So these are some of the challenges, and we need to deal with them, discuss with the family, have a family meeting. It's very important as a team. So everyone, it's not just the doctor, it's not just the psychologist. It has to be everyone together, join hands to take care of a person with dementia.
What about like external caregivers when they?
Yeah, the external caregivers are also there. Like, Anu is here from Better Daily Life, and she provides caregivers at home and to take care. That also can be a financial burden to the family. How do they take care of it? But it is required many a times, because if a family member is taking care, they need to spend half of their day taking care of the person, which means that probably they need to take their days off from work, or they cannot join a work. They do not take up working outside the house, which becomes a financial burden. Or if they employ a caregiver, that also is a financial burden. So dementia comes with a lot of other burden along with the psychological, medical, there is this financial burden, legal burden. So all these are some of the issues which need to be dealt together. So coming to that, Swati, like I said, it gives a lot of stress and burden to the caregivers, the families. I would like you to tell us about what are the psychological impact of dementia on the person who's having dementia and the family and the caregivers.
Right. So I'm here going to be talking as a psychologist, where I've seen patients with SarvAveksha and the families, and also from my personal experience of taking care of my granddad, and also maybe my grandmom right now. So I have a lot of things personally also to relate with and share with. To start with, as we understood, right, it was always a difficult to differentiate between, is it like dementia or Alzheimer's? Because the people, the person who has dementia, how they start showing in the signs and symptoms itself will get delayed for the people around them to understand. Like the early signs are always neglected. Like that's what happened in my granddad's thing. Like he used to say these small things and it was just got brushed off. And my grandparents were living by themselves and there was not much of notice was given to that. So probably early intervention at that time would have been different. So the signs that starts and the kind of psychological issue that starts are very different. So at the early stages, I'm going to divide this topic into early, middle, and later stages. What are the psychological issues a family goes through, the patient goes through, and the caregiver goes through? So the first, to start with early stages, there's more to do with the patient, because they will be very irritated, they will get angry, they're going to have a lot of confusion that I wanted to say this, why didn't I'm not able to recollect the word, or I don't know to use the right word. And they will go to a shop and they will forget to take the change, or they won't give the money. So these are the small things that will start. So at that time, there's a lot of pressure on the person rather than the family, because family would have not even known but by that time. So it starts like that with the patient. And when it goes to the middle stage, that's where the family's involvement starts to take place. So where few things what the family members will do is, like, if the patient comes and says, like, did I eat, or did you eat, I want to do this. And the daughter or the son or whoever is staying, they would say, like, just did this, ma, you just did this, pa. They'll get irritated, and it's natural, right? Like, all of us are human beings. So, like, that's how it is neglected at the starting. We will think they are just repeating it, or they just want to do it again, or something, like, we might assume. And it'll gradually start to increase, like, say 2 times they did, then it will slowly increase to 3-4 times. So like that, there will be a gradual increase on how they start showing the signs. So then the family members will start to, like, recognize, okay, like, there is some kind of a thing and we need to give attention to. They might go missing at times, they will go to temple, they will not come back. Then there will be a lot of pressure on the family, they will get, like, where are they, what happened to them, and then they will go looking for it. So these are the kind of things that will happen, and that's where the caretaker intervention will generally happen, where the family feels that a caretaker is needed. At this stage, it's more like the patient and the family, where the family started to recognize that there are some changes, right? What the family has to do is accept the person. That's the first thing to start with, where the family needs to understand that there is some difficulty that they are facing and they need help with, they are unwell, rather than trying to tell them what to do, or saying, don't do this, don't do that. And then it shifts to that later stage. So later stage is where so much of psychological stress will fall onto the family and the caretaker, and mostly, I would say, nothing to the patient, because the patient is not even aware of where are they, who are they, what are they. Like, they won't know anything, we won't know what is feelings to them, they don't know thoughts, they have no idea, there's no idea of past, present, future, nothing. So that's where there's so much of pressure onto the family members and to the caretaker. So imagine a family member, when they see their parents continuously walking or continuously telling that I need to take a bath, or saying, like, I'm hungry, I'm hungry, I'm hungry, whereas they would have eaten just like 5 minutes before. So there's a lot of patience that has to be there, acceptance, and give whatever support you can. As Dr. Ashajit mentioned, if you feel that you are facing a burnout, you can, like, put them to a care home where they are well taken care of just for some time, so that you find that balance in your life. Because for anyone, at the end of the day, most of the people are like the sandwich generation. They have their children to take care, they have to go to job, they need to look into their personal issues. So there's a lot of things that goes into the person, also the family who is taking care. And coming to the caregiver perspective, more than the family member, when a caregiver is there, the caregiver goes through a lot of burnout, emotional mood swings, everything. Like, imagine a person staying with the patient who is completely unaware, and they will gonna keep repeating things. They might be very anxious, they might be very agitated, there will be aggression, they will even have hallucinations, they will have psychosis at the later stage. They would keep saying, I'm hearing this thing, I'm hearing a doorbell, I have to go open the door. Or they would say, this person, like, they would see a picture in the wall and they would say, this person is coming to kill me. Like, imagine a caregiver who has to listen to this all the time. There will be patients who will say, I want to go to washroom, they'll go like maybe 100 times a day. Like, we recently saw a patient who kept repeating just this word, amma, appa. Continuously, she was repeating until she felt tired. Like, her voice changed, everything changed. So caregivers' burden and stress is 100 times more than the family, actually, in this perspective, because they are with them 24/7, trying to take care of them. So what I would say is, the family has to support the caregiver in whatever ways that they can, like, say, a psychological help, or ask them to talk to the doctor of the patient, so that they have some space of venting out. Maybe, like, in a day, half an hour or 1 hour, they can take a break where the family member can, take care of their own mother or father who is going through this. So these are small ways in how it can be managed. Now that we spoke a lot about, this is what is dementia, and these are the psychological issues that will happen, and this is what one can anticipate. But this is not like a fixed one saying like this is what will happen. Everyone goes through a different phase, and like depending on the family, depending on the caregiver, everything will be very different. It's very person centered. Like this family, what applies to this family might not apply to the other family, or what one family goes through might not be the other. So it's more like me to take one day at a time. What happens today, deal with it, and then go for next day. This is how it has to be worked out every day, which is kind of tiresome. So I feel like families can opt out for help, like go to a psychologist. You just went out, just say that these things are happening and I'm like very worried. And also having the doctor by the side and always updating and asking their suggestions what to do. And so you would feel you're not alone in this. You feel like there's an external help, and that's what we need at the end of the day, right? Some comfort and support. So talking about comfort and support, I'm going to ask Anu this question of like, what are the trainings is needed for a caretaker? Like, what do we look out for? What is required? Like, say I was from that family, right? I didn't know back then what do I expect from a caretaker. The caretaker half the times will do something and we will do. So there's a lot of mismatch in expectations and what is required. So can you tell us what required of the caretaker, what training they need to do, and what should be there?
Can I just take a minute here before we move on to the next Anu? I would request, a lot of you have joined here, and we are very happy to see all of you here. But we have Mr. Lawrence here with us, and we would like him to speak his experience, because unfortunately his wife has dementia and he is managing that all by himself. And so I would request him to just speak about his challenges, what goes on with him, how he manages his wife. Mr. Lawrence, thank you for joining us. You need to switch on your mic, Mr. Lawrence. You're on mute. So you will see the mic there, and you just need to click on that. It'll unmute. You can see the mic on your screen.
Anu, can you unmute Lawrence?
Yeah, if you can unmute. Yeah.
Yeah, I'm just trying to unmute him, but he's not accepting that request. Let me try call him online.
Okay, until then, let's maybe take a question from the chat. Let's see if, please feel free to add in questions if you want. So Kranti has asked, how early is it possible to recognize dementia? It seems there is a bleak line between forgetfulness and the conditions of dementia. Is it possible to delay or prevent dementia? So there's 3 questions. So probably the first 2 questions.
Yeah, so how early it is to recognize is, when somebody says that they have forgetfulness, they're forgetting things, I kept something and I forgot, or I forgot that I had a meeting. I reached there, but I didn't know that I had to go for a meeting. Yeah. So these kind of forgetfulness, which are little concerning, like, you remind someone and still they forget, then you know that there is a problem. Then you please see your doctor, a general physician, a family doctor is what is best, because the family doctor has been following you up and would know exactly what is your condition. Because like I said, there are other physical conditions which can cause dementia, like diabetes, uncontrolled hypertension. So somebody, if they have that, this needs to be looked into. His other general health needs to be seen and examined. And then so we have this, like I said, we have a scale. So we ask the people to, we assess them using that scale, where we ask them to draw something, recall, or tell us an address or something which is little difficult but not very difficult. And if they are not able to recall, then you know that there is dementia setting in rather than just forgetfulness. And coming to the other question is whether it can be prevented. So like I said about Alzheimer's, that it can be, it's under trial that immune modulator can be tried. But otherwise, there's nothing, no medications which can prevent dementia. It is just following a healthy lifestyle. So if somebody has diabetes, they need to take care of their diabetes. If somebody has hypertension, it needs to be taken care. Many a times we find, because it's a younger person, they say, I'm young, I don't want to take a blood pressure medicine because I might have to take it forever. Yeah. So I prefer not taking.
Don't stop. Don't talk.
So these are some of the things which need to be managed, which can prevent. So a healthy lifestyle is what is most important, where you have a healthy diet, controlled blood pressure, controlled sugar, having a nutritious diet, a healthy diet is very important. Managing your weight, and overweight, obesity also causes dementia. So these are some of the preventable ways of reducing your risk for having dementia. Yeah.
It's important that we have our regular checkups with a physician, at the same time a counselor, because many a times a depression can also cause. And when we go to a regular counselor, regular follow-ups, it doesn't mean that when we have certain symptoms, when we have an anxiety issue, then only we go to a counselor. No, when we are healthy itself, it is important we include that counseling method, a psychologist or a counselor to go and see frequently. So they will be the first people to note like if there are any changes. Okay, so I think that also we should include.
Thank you. So we'll come back to the questions. I think we have Lawrence sir with us.
Sir, online.
So can you please introduce yourself and talk to us?
Hello. Hello. Hello.
Yes, sir, we can
Yes,
hear
sir, we
you.
can hear
Please
you.
go ahead.
I did hear in between you were telling someone, right, that you'll come back.
You can hear me? You can hear me?
Yes, yes, we can hear you.
I am here.
Yeah.
Sir, we can hear you.
Okay.
Hello. Can I talk for a few minutes?
Sure.
Yeah.
Sure.
I have a question. I want to know, does OSA predisposed to dementia? OSA patients, are they prone for dementia and Alzheimer's? And what is the preventive action in spite of using CPAP if they feel all these symptoms, what you told?
Sure, we will come back to that question in the end, Dr. Preeti. Thank you for the question.
Okay, thank you.
Lawrence, sir, you can speak. We were able to hear you. I think he is having some network issues. So let's
Yeah, I
maybe
think so,
continue.
Swati.
Let's just continue.
Yes.
Okay. So Anu, as I was asking you, what one person has to expect out of a caretaker? What are the trainings that is needed?
Yeah, yes, Swati. Swati, unfortunately, there's no easy handbook that we can train a caregiver, to know each and everything or, do accordingly, because we know that in the case of dementia Alzheimer's, there would be different unpredictable situations or incidents and episodes. But the main aspects is like, the staff should know about dementia disorder. They should have a clear understanding about it. Caring for a person with Alzheimer's or dementia, as you all mentioned, it can be confusing or upsetting for people if they are not trained properly. So the staffs should have a good understanding about the condition of the patient, how this disease progresses over a time, how people with these conditions often behave, and how to communicate with the patient who has dementia, and the importance of person-centered care. So this is the important aspects which we focus on training part. And the second point is, because a person who is diagnosed with any of this disorder, they need assistance in their ADL. So, the staff should be able to assist them in performing their daily activities. So, they can actually lead a quality life, and they should be trained to manage the hygiene part of the patient. That is, the bathing, which includes bathing, toiletry needs, head care, mouth care, nail care, all this. And the third aspect, like, we focus in the training, that is the home safety tips. So as Dr. Ashwajit mentioned, home safety is an important skill that every staff should master, because we should expect that at any time, like, there can be an imbalance with the patient, there can be a fall or a hurt or a cut, so, or a tripping, slipping, all those things can happen. So they should keep observe and alertive about it and support the patient. And sometimes medications can be dangerous if the patient is not forgetting when he or she had taken the last dose, or, a person who is prone to forgetting about all those things, keeping a medication box near to that person, that is dangerous. So all those things, actually the medication management, which comes under the role of the caregiver or a nurse who is deployed at home. And again, as you mentioned, there is a tendency, if the door is kept open, and the person can actually go out without telling anybody, and they can go to the next street, they don't know how to come back. So they have to actually make sure, if nobody else is there, the doors are locked, and somebody is there near to this person. So that's very important. And the other aspect is managing the changes in their behavior, because as you said, so Swati, they'll be agitated, aggressive sometimes without no reason. So the staff should be able to understand when there is a mood swing, And the better approach is simply to agree whatever they say and without any comments, or just, force them to do what basically they wanted to do. Without doing that, just to agree with whatever they say, try to change the topic, relax them, calm down them, and then, divert them to a new activity. So that's very important. Otherwise, because we know that caregiving is not an easy task. And, especially when we are giving care to a dementia or Alzheimer's patient, like the stress is more. And the other aspect we focus in training, that is the first aid and handling an emergency. So it's very important to prepare the staff, as I said, mentally for, meeting various emergencies. And if an emergency occurs, they should remain calm and call to the emergency number what they have, or call to the nearest healthcare provider or us, and just, proceed further. So they should know what is the basic first aid they have to do. So in general, equipping staffs to meet the needs of such diverse patient population and, render the care, we need to organize it. Not only the training, retraining, it is required. And that's what actually we focus in terms of the training part, Swati.
Right. So one thing that I want to really ask you is also, what are the challenges that the caretaker faces? Because clearly they are the one who stays literally 24/7, they hardly even sleep because they have to be up all the time, right? Be alert. So, and that's the most neglected part also. People usually talk about the patient and the family, but the caregiver is actually the person who always does most of the things. So what are the challenges? Because you work closely with the caretakers, you will know better. Can you tell us what others need to know on this?
Yeah. So as we all mentioned now, and we all know that the journey is not smooth without any challenges. And, it is stressful, even if it is a family caregiver or an external caregiver deployed from a provider. It's very stressful and an intensely emotional journey. So as Dr. Ashijit and Dr. Praneeth clearly mentioned, it's more of care than cure here in this condition. And the caregivers, actually, they leave their family and they're coming, staying with a patient, who don't even
I'm here.
recognize.
I'm just on the call. I'm telling the call. That's right. Yeah. I'm only here. I'll walk up and down. Be here in front of you, so that you know I'm here. You just rest.
Lawrence, sir?
7 o'clock. No, 7 o'clock. Continue. Interference. So I'll be here. I'll sit in this place. Don't worry. I'm here. No,
just mute.
You're not alone.
Yeah.
Just take it easy.
He's managing this
He was telling that to his wife, you are not alone.
managing
I
his
think,
wife.
yes.
Yeah.
I think
if you see, how calm he is while talking to his wife.
Yeah.
And every time we go to visit his wife, this is the best thing I have observed with Mr. Lawrence.
Yes.
So calm, so composed,
Yeah.
answering the same question 10 times and speaking with so much love and affection. It's
if Lawrence
amazing.
is online and if his line is audible, we can ask him to speak words. And
Lawrence, you can go ahead, because we do appreciate that, you have to go and take care of your wife.
Yes.
So
Lawrence,
please.
sir, can I please? Lawrence, sir, can you hear me? Hello.
Again, I think his video has again got some.
Can you hear me?
Yes, we can.
Please speak few words, sir. We were waiting to hear. I think there is some problem. He is trying to speak.
Organization and wellness organization. And Dr. Ashujit came in the picture. And he started talking to my wife and phone and give me a few tips and advices, and I followed that. And what happens is, since I was managing on my own, and of course I'm not working, so I was able to take care of her. And I employed somebody to just be in the daytime with her. Then in the night, she started waking up 2 or 3 times because she can't go to the toilet on her own. Then I had to get up. Then only the Dr. Sujit said that it is better that you employ somebody in the night to sleep with her. So I must say that by God's grace, I got a very good person. This person is very experienced. She has dealt with a lot of people, so she knows how to take care. And also she talks a lot and she jokes and cracks. And that is what this dementia patients need. I didn't know that. My wife used to be very quiet. So then as soon as this lady started coming, I see a change in her. One by one. Let me tell you what I did. I had the feeling that I should make her listen to something, activate her mind. Now, how do I activate the mind? So I bought one caravan radio and I started playing all the songs, the Hindi songs. She's very fond of Hindi songs, so I started playing in the daytime. And then I have this, Android TV where you can get YouTube. And she loves Richard Clayderman's piano recitals. And she will also, so I started playing that. When I did that, what happened is she started singing some old Hindi songs. Then piano recital also, the tunes she knows, she'll either hum or if there are songs she knows, she'll sing. I said, keep singing. And then you close your eyes and concentrate on the music. So I started doing this, and that plus next thing is she was always confined in the 4 walls of the room and the sitting room. So what I did is I tried to make her walk. She wouldn't come out. So I put her on a wheelchair, and then this lady who came, her name is Sudha. So Sudha started taking her out in the wheelchair. We have a beautiful sort of a garden compound, because we are in a flat where there is so much of greenery, flowers. Once she started going, I see a lot of improvement. She seems to be enjoy everything. Today, first time she normally doesn't remember the names of the. I have about 4 ladies working for us, so none of the names she will remember. Today she asked me, "Where is that lady?" I said, "Which lady?" She said, "Sudha." I said, "What? Oh, you remember the name?" He said, "Yeah, where is she?" So I said, "She'll come a little later. She'll come in there at about 12 o'clock. That's one thing. Then second thing I noticed the improvement is, yesterday she was almost like crying and saying, "I'm sorry, I'm so sorry, I'm not able to do anything for you." I said, "Why should you do anything? I got people employed, so they will do everything for us. You don't have to worry. Don't feel, you should not ask any sorry or anything. And then forgive." I said, "Don't ask for forgiveness. You've not done anything wrong. I'm happy, you're taking it easy. We don't have to, we are finished, all working time is over. Now we are free. We just enjoy our life." So this is the way I'm trying to sort of talk to her. And she's showing day by day some, even the ladies are saying, "Oh, then she said, I want to go out. I want to go and see the plants and flowers." So every day she loves to go. So that is how I have. So there is some improvement. And this is what I have. I think it's the important thing in this way. For dementia patient, what is important is the patient's very close person should be there to give attention. They need attention, and because she's happy as soon as they go out and come back. "Oh, you come back, come and sit too." So this is what is lacking in many cases. So in my case, because I am
I think we again lost him.
Yeah.
But it was very beautiful to hear whatever he shared. Like that's exactly what we were also
doctor said.
I think, Anu, we
Yeah.
can just continue,
Sure.
because I think
Yes.
this video is hung.
Yeah.
And
Thank you, Lawrence sir. And coming to the question, Swati, so the major challenges, I'll just point out few, what the caregivers face, when they provide, because this is a 24/7, they are with the patient. Yeah. So the first is basically they feel very isolated at times because they leave their family and coming to another house and taking care of a patient, and they just often feel that they are completely cut out from the outside world, the friends, their family, and so much time they spend, their energy is spent to take care of a patient, and and they don't get time to take care of themselves. That's a self-care, because they just they can't follow any of their routines, because and we can't just fix a routine for a patient, especially who is diagnosed with dementia or Alzheimer's. Anytime, the routines will not be, stable. So one day would be okay, the next day there would be changes with it. So that is the main challenge they face. And handling agitation and aggression, as Swati said, like, even the own family members, like, at times, if we explain, even like, we remain calm and we try to explain to them, but sometimes the handling agitation and aggression, it is there and it is difficult, especially when we deploy an external staff, like, they feel that they lose their independence, and, they think that they are a threat. Like, somebody is coming from outside and staying in my house, and, he or she will do something harm for me. That kind of, like, it's part of their, disease, but still, like, so because of that, they start hate the people who are there. One or the other reason, they figure out to, send them away. Other thing is actually, because we know that the patients can't recognize what kind of care or effort the caregivers, that is their family caregivers or the deployed caregivers, they are putting, like, to take care of this patient. And it is actually, they don't get that appreciation from this patient. So that is little, sad part. Even, like, there's no kind of that encouragement from the patient side, but of course the families will take care of it. Because with that cooperation from the families would be there. Otherwise, it's very difficult for an external person to stay at home and take care of a person who is going through. Because the other case, at least the patient can realize, okay, he or she is doing something for me, and they can, but in this case they don't appreciate it. And in some cases, actually, this is one of the challenge, because there would be family conflicts, in the sense, like, there would be difference in in opinions or the decisions what the elderly family members and the children take. So this can be a cause of the family conflicts, and like, the caregivers also get stressed out because of this difference in opinion. That can be, like, different aspects, maybe, like, the kind of care routine what the staff is giving, or, like, even for the doctor appointment, or even for the food what the patient is eating, there can be difference. So this is actually cause the stress in the staff, and they sometimes feel, oh, I have too many things, and some cases we see that there would be inadequate support from the family. That's very, very rare, because we know that, but in some case we see that the family members want give, because we know that this is a partner program, wherein, as you said, the physicians, the nurses, the family, patient, caregivers, everybody has to work, join hands and work together. So sometimes if this inadequate support also cause stress in the staff, and they won't be able to perform their duties well. So these are the main challenges, I can say, Swati.
Thank you so much, Anu. That does give us a lot of information and understanding, what are the challenges of the caregivers. So we will get into the
Actually,
questions.
related to this, there is a question which has been raised by Mr. Kiran, and he says, how do you, indicate what are the signs of caregivers fatigue? How would you diagnose that? So I would just like to answer that. This is very important in continuation to what you said, all that. And Swati also mentioned about, how important it is to get, some kind of a respite for a caregiver. Now, what are the signs of fatigue is the person can become very irritable. There's lack of sleep. The person is not able to sleep even when they have time. Yeah. And it can be that the person becomes aggressive also at times, because they can shout back at the patient or at the family member, the caregiver. Then it can be that the person feels very exhausted, physically exhausted, that I'm unable to do anything. I just want to lie down. It's a fatigue. It's a caregiver fatigue. It's a mental fatigue, actually, not a physical fatigue. But it can cause physical symptoms like excessive tiredness, palpitations, tremors, and nausea, vomiting. So these are some of the signs of caregivers fatigue. As soon as somebody observes that these symptoms are going on, that somebody is having these kind of symptoms, and if it is not getting better in a day or two, I would say just watch for a day. And if it is not getting better, by just talking, giving some break to the caregiver, maybe even telling them to go back to their place for a day, giving them a break is very important, so that they don't break down and have an exhaustion where they cannot come back for work. So that is one of the questions which was put forward.
Thank you for that question, Kiran. So coming back to the question what Dr. Preeti has raised, right? So sleep apnea, effect on dementia. Can you please tell about that?
So yes, so sleep apnea usually reduces oxygen supply now to the brain. So it will not directly cause dementia. Okay, but also we need to understand here is when it is continuous for a long time, if a brain is not getting proper amount of oxygen support, that can cause irreversible damages to the brain. Okay, when these kind of a damages happens, certain parts in the brain, depends which part of a brain it's get impacted. Based on that, if there is a possibility of having a dementia, then they may have it. But it's not that sleep apnea causes dementia, not directly into that.
Not every time. Yeah.
Okay, thank you. So Ranjani has asked one question. My father is in a stage where he is forgetting where he is heading to, and also he doesn't take the change back in a purchase. What is the kind of help I could extend to him to keep him safe from progress in his problem?
Yeah, so thanks, Ranjani, for that question. And yes, actually, we have met her father, and we know that he has initial stage of dementia, because when we initially started visiting their home, he did not have signs of dementia. But then he was found to be having, forgetting things, repeating the same question. And like he knows me, but he would ask me the same question again. So what's your name? That kind. So he is in the initial stage. And there was a time when he was even forgetting, like they are very careful by not letting him go out on his own. He was going out and coming back home also with his dementia. So it is very important that there is some kind of a identification which is with him, keeping a card in his pocket, which gives the contact number, address, his name, so that he can be brought back in case he gets lost outside. And then involving him in different activities, like I said, prevention of dementia is only by adopting healthy lifestyle. And I know Ranjani's father is having a very, very healthy lifestyle. At this age, he can break a person's bones. He's that strong physically. So his diet is very controlled. He's quite healthy that way, but unfortunately for this dementia. So, involving him in some activities like music therapy is known to help dementia, delay the progress. Involving him in some other physical activity, like we usually say building blocks or coloring, these are some of the activities which can help with the person who's having dementia and delaying the progress of dementia. But yeah.
And also, can we have like a board, having at the doorstep, like, so Ranjini also certain times says that, when she's going out, she says him that I'm going out for this purpose. And he forgets that, she informed him. So having a board written there that I'm going for this purpose. So whenever he thinks, where is Ranjini? Where is my daughter? It's like, it helps a lot for a person also not to get panic. Her father will not get panic. And oh, fine, she went for this. Right now, he knows that he's having a dementia. Okay, right now he accepts things. And that's why he, he's particular, like, there is like, Ranjini comes in time, like, Papa, this is the food time, let's have lunch. So, it's really a tough for Ranjini to being a professional person and taking care of, a lot of stuff, it's a bit challenging. And she herself is managing, it's a challenging thing, yes.
Right. Thank you. And Uma, thank you for sharing your experience. So let's just take this one last question, which also I have. So so Kranti has said, it seems like the family doctor and general physician might play an important role in early recognition. So also I faced this issue with my granddad where the psychiatrist said that he cannot treat for, early dementia. So he asked us to go meet a geriatric, doctor or a general physician. So that was a new learning for me, that because I associated somewhere, that this could be a thing related to, mind and brain, so psychiatrist will treat. So like, who is the person who we have to go? Like, we did clearly mention family doctor do play a role, but can you also talk a little more on that aspect?
Yeah. So that's very true that, it's a family doctor. I think I mentioned that somewhere, that it's very important to have a family doctor who understands the family dynamics, who has been observing the person for a very long time. Also, like I said, there are some other conditions which could be leading to dementia, like diabetes, hypertension, thyroid, all this. So how do we manage that is very important. It's not about treating dementia, but treating other causes which could be leading to dementia, managing that. And of course, like medications, I have already explained that there are medications which can delay the progress, but there's no definite answer to it. Like, we really don't know how much does it help. Because frankly speaking, from the experience of managing patients, we haven't found any improvement with those medications. Maybe if it's given in very early stage, it does help, but later on, it really is not very helpful. So having a family doctor to manage your other illnesses, other medical problems is very important. And the family doctor would be able to diagnose dementia at an early stage as well. So, yeah.
Okay. So you're actually emphasizing the fact that everyone needs a family doctor. It's kind of lost right now, I feel. Back in days, we did have this one doctor who we would run to, but nowadays it's like for each of thing we go to one doctor, and there's no link between what doctor does what. So yeah.
And that's what SarvAveksha is doing.
Yes.
We are bringing back the family doctor, the bag which comes to the home, the doctor who comes home and sees the family. Yeah.
Right. So thank you everyone for staying. We are like really late by half an hour almost, but still you guys stayed with us. So let's end today's talk with a video, like how we started the talk with the video. Once again, thank you for everyone, and we will be continuing talks on health related to health. So watch out for the space for more conversations and discussions. Thank you everyone. Thank you doctors, and thank you Anu.
Thank you so much.
Thank you, everyone.
It's not audible, Anu. Can you play from the first?
Leaving at 8, Jane.
What time should we leave tomorrow?
I think about 8. What do you reckon?
Yeah, that sounds about right. What time should we leave tomorrow?
I told you, 8.
What time should we leave tomorrow?
We're leaving at 8, Jane.
What time should we leave tomorrow?
I think we should leave at 8.
Thanks, everyone.
Thank you.
Thank you so much.
That was a
That was a lovely
video.
video.
Thank you everyone for joining us and being with us today. And we look forward to having you again soon.
Thank you.
Thank you.
Thank you, Dr. Ashwijit, Dr.
Thank
Pradeep,
you. Thank you, Anu.
Swati.
Thank you, Anu.
Thank you.
And Swati. Thanks.
Thank you.
Dr. Sarita, please do message us in the WhatsApp group. That's the reason we created the group, so we can, just talk. So please do drop in a text there. Thank you.
Okay, thanks. Yeah, thank you.